this at Secretary Blinken's hearing last week. This is really for my colleagues. If you haven't had a chance to see this Foreign Affairs Security Training Center facility at Fort Pickett in Virginia, I would really encourage you to go. I took a visit during the recess. State Department colleagues were with me. This came through this committee back in 2014-15, and it is truly impressive. I took some staff there on a Friday, 41 weeks a year. They run week-long programs for FSOs and their family members to get security training, and Friday is the day of the exercise where they have to put all the security training to good purpose. It's in a mock-up of a town square with an embassy compound. It involves an attack on an embassy that is frightening, even though I was told what was going to happen and knew what was going to happen. It was very, very intense, but looking at the care that has been devoted to developing this security program, in addition to the fact that that's the 1 week-long program for all FSOs. There's also, if you want to be in the security side of state, you do 11 weeks there in your first year, 17 weeks there in your second year, and another 11 weeks in your third year before you do an overseas deployment. And I just want to applaud the State Department for this really comprehensive security training. Sadly, we need it in ways we didn't in the past, but what I saw firsthand, it would be hard to describe. I just hope some of my colleagues might have a chance to see it.
Yeah, thank you for going, Senator. I was there on a Friday as well last fall, and it is quite realistic, the training. And just to amplify that point, I've heard 2 anecdotes in the last few months of officers who have been in a circumstance overseas where they said, my training at FAST-C made a difference. One was in Oman, where a contractor assigned to the embassy was stabbed in the lungs, and the officer jumped in. He was a neighbor and did whatever emergency medical procedure that he learned at FAST-C, and he said it came back from that training, and the medical unit said it probably saved that person's life. So it is. We appreciate the support that you have, but also of the Congress for this facility. It is really state of the art, and I understand we took you out on the fast driving track, and glad you survived.
Yeah. I had a very calm driver, and as long as he wasn't sweating, I wasn't sweating. Let me ask you this: in the security space, update us on the administration's effort to determine the cause of Havana Syndrome.
So this is a continuing effort on the part of the intelligence community and across the interagency. Last fall and earlier this year, we had 2 panels, one that the Director of National Intelligence commissioned, and one that our Diplomatic Security Bureau commissioned of the JSON, which is academic experts. Some of the JSON report is unclassified, so that's out there for you to read, but there's a classified portion, and the DNI issued an unclassified summary. And what both of them found roughly is a number of these cases can be explained by environmental and health factors, but there's still a percentage of them for which we don't have an explanation, and we have not identified or attributed this to a particular actor. It's still a frustrating head scratcher that we haven't been able to figure that out.
And frustrating is a good word, because a number of State Department personnel have expressed frustration about what they maintain are actions by the department leadership to either deny them or family members affected by this access to proper medical care. Talk a little bit about what you're trying to do within state to make sure that our State Department members and their families get access to medical care for this condition.
So at post, if somebody reports an incident, they're supposed to both report it to the Diplomatic Security Bureau official at post and to the medical unit. And in both cases, they go through a questionnaire to try to get a common set of data. If their symptoms are sufficient that warrant medevac back to Washington, that will be authorized. And then people who need care quickly at a higher level, we've set up a contract with Johns Hopkins University Hospital in Baltimore to get holistic care, if you will, for officers, and we're also getting some officers into the program at Walter Reed if that's warranted.
One last quick question. In February 21, the department rolled out a new payroll system. There were a number of glitches with that has delayed people getting paid. I understand Secretary Blinken has indicated that in instances where pay was long delayed, the State Department will commit to paying interest on those. Just give us an update on how is the system now fixed, and are you taking steps to remedy situations that were caused by people not getting paid on time?
Unfortunately, the system is not fixed yet. The software was implemented. its implementation was planned by the last team, but it was put in place in March of last year. And in shorthand, I think we were a little too ambitious with this software doing everything at once, and it's had a lot of errors. Secretary just sent out a workforce message apologizing to the workforce and committing to where we owe people to pay interest. And we've engaged some professionals, including a former CIO of the department, to help us figure this out. It's at our center down in Charleston, and try to work through the glitches. We've also set up an online-based portal for people to report their challenges, because we had a not very efficient system for that. Let's try to improve the response time to help people get the compensation they are owed.
Thank you. I yield back, Mr. Chair.
Thank you. Senator Schatz.
Thank you, Mr. Chairman. Thank you for being here, Secretary. Freedom House says that global internet freedom has declined for the 11th consecutive year.